there are bold claims that a newly discovered anti-aging therapy might do the impossible: rewind age itself. For the first time in history, some scientists say we can now look into a camera and say with a straight face, "You may not die." Sounds unbelievable, right? But what if living past 100 wasn't rare at all? What if it became normal? Researchers around the world are developing revolutionary technologies that could redefine aging. From reversing cellular damage to growing replacement organs in labs, these breakthroughs hint at a future where 120 could become the new 80. So let's dive into the innovations that may not just extend our lives, but help us live those extra years in good health. 1. Genetic engineering. Rewriting the code of life. One of the most powerful tools in modern science is genetic engineering. With technologies like CRISPR-Cas9, scientists can now edit the human genome with pinpoint precision. Imagine removing mutations that raise your risk of cancer or Alzheimer's before the disease ever begins. That's no longer science fiction. Back in 2019, CRISPR was used to treat a patient with sickle cell anemia, marking a historic milestone in gene editing. That therapy, now known as exaggam-globin autotemkel, or Casgevy, earned FDA approval in 2023, becoming one of the first real-world examples of genetic engineering transforming medicine. Now, researchers are taking the fight directly to aging. By targeting genes tied to cellular repair, immune system strength, and chronic inflammation, they aim to slow the biological clock. Early lab results are promising. If scientists can enhance DNA repair, preserve telomeres, and silence age-accelerating pathways, we won't just live longer, we'll live stronger. Genetic engineering might one day give us the chance to age without decline, adding not just years to life, but life to years. 2. Nanotechnology. Medicine at the molecular scale. What if tiny machines were inside your body right now, constantly repairing damage, destroying disease, and keeping you young? That's the promise of nanotechnology, operating at the scale of atoms and molecules. It may sound like science fiction, but it's already reshaping medicine. Today, nanoparticles are used to deliver chemotherapy drugs directly to tumors, sparing healthy cells and reducing brutal side effects. A real example is Doxil, an FDA-approved nanoparticle-based drug used against ovarian cancer and Kaposi's sarcoma. But that's just the starting line. Tomorrow's vision includes nanorobots capable of clearing arterial plaques to prevent heart attacks, repairing microscopic tissue damage, and even fighting infections at the molecular level. Researchers are also exploring how nanosystems might deliver anti-aging therapies, targeting inflamed or senescent cells directly. Imagine your body continuously monitored and maintained at the cellular level, a self-repair system running 24/7. That could be the foundation for not just longer lifespans, but dramatically better health spans. And the world is already investing heavily. The global nanomedicine market topped $350 billion in 2022 and is still climbing. We don't yet have fully autonomous nanorobots patrolling our bloodstreams, but the breakthroughs happening today are paving the way for a future of personalized, preventative, and even age-reversing medicine. 3. Regenerative medicine. Growing new life. For decades, the only way to deal with organ failure has been transplants, a system plagued by long waiting lists and the constant risk of rejection. Regenerative medicine aims to replace that model entirely by using stem cells to repair or even regrow damaged tissues. Stem cells are remarkable because they can transform into nearly any type of cell in the body. Researchers have already created kidney organoids, miniature versions of kidneys grown from stem cells. While they can't replace a full organ yet, they're being used to study disease and test drugs, laying the foundation for future organ regeneration. Other successes are already real-world. Bioengineered tracheas and skin grafts have been transplanted into patients, proving regenerative medicine isn't just theory. It's happening now. The implications are staggering. Instead of replacing a failing organ with someone else's, one day doctors could grow a brand new one from your own cells. That means no shortages, no rejection risk, and a powerful new weapon against age-related decline. Regenerative medicine could mark the shift from patching up the body to truly renewing it, giving us the possibility not just of longer lives, but healthier, fully restored ones. 4. Artificial intelligence, predicting and preventing disease. Artificial intelligence is already revolutionizing healthcare, and its role in extending human life is only just beginning. By analyzing massive datasets, medical histories, genetics, lifestyle factors, AI can predict disease risks before symptoms even appear. This proactive power transforms medicine from reactive treatment into early intervention. One of the most famous breakthroughs came in 2020, when DeepMind's AlphaFold solved the protein folding problem, accurately predicting protein structures. This leap has accelerated drug discovery and deepened our understanding of diseases at the molecular level. At the clinical front lines, AI is helping detect cancers, like breast cancer, with over 90% accuracy, enabling earlier and more precise diagnoses. And the true strength of AI is personalization, systems that tailor insights to an individual's biology, helping patients and doctors make smarter, faster decisions about health. 5. Wearable health technologies, your body's real-time dashboard. Health monitoring has moved far beyond step counters. Today's wearables track heart rate variability, sleep cycles, oxygen saturation, and even early warning signs of chronic disease. These devices put healthcare in your hands. The Apple Watch's ECG feature can detect atrial fibrillation, a major stroke risk factor, while continuous glucose monitors, now widespread since 2023, have revolutionized diabetes management by providing real-time readings without painful finger pricks. The future is even more ambitious. Researchers are developing wearables that could detect cancer biomarkers, monitor immune system health, or flag early signs of Alzheimer's disease. Imagine a device acting like a personal health assistant, alerting you to risks before they become emergencies. By shifting medicine from hospital rooms to our wrists, wearables are turning prevention into daily practice, helping extend not just lifespan, but health span. 6. Biotechnology, reprogramming life itself. Biotechnology harnesses living systems to create therapies that repair, regenerate, and even reset the body's aging clock. From synthetic DNA to bioengineered tissues, this field is transforming medicine at its core. One breakthrough came in late 2022 when researchers performed the first human transfusion of lab-grown red blood cells, a milestone that could lead to custom treatments for rare blood disorders. Early, yes, but proof that personalized cell therapies are becoming real. Another frontier is cellular reprogramming, using tools like Yamanaka factors to reverse epigenetic changes and push cells back toward a youthful state. In lab studies, cells rejuvenated, showing hints that age itself can be rewound at the molecular level. If scaled, biotechnology could combat aging at its root, delivering not just longer lives, but lives renewed from the inside out. 7. Brain-computer interfaces, enhancing the mind. What if technology could directly boost your brain? Brain-computer interfaces, or BCIs, are making that vision real. By linking neural activity to external devices, BCIs allow paralyzed patients to move prosthetics, communicate, or control software with thought alone. In 2023, Neuralink received FDA approval for human trials, a major step toward treating paralysis and neurological disorders. But the vision goes far beyond medicine. BCIs could one day restore memory, slow cognitive decline, or even prevent diseases like Alzheimer's and Parkinson's before they take hold. The implications are profound. If we extend lifespans, we must also preserve mental vitality. BCIs promise not just more years of life, but more years of sharp, fulfilling experience. 8. Telemedicine, healthcare without borders. Once a convenience, telemedicine is now a revolution. From video consultations to remote monitoring tools, it's breaking barriers of distance, cost, and access. The COVID-19 pandemic accelerated its adoption, pushing the market to nearly $87 billion by 2022, with projections soaring higher every year. Telemedicine isn't just about saving time. Integrated with wearables, it allows doctors to monitor heart disease, diabetes, and other chronic conditions in real time.